Prostate cancer is throughout its entire lifespan, whether it is confined to the prostate itself or whether, as happens all too often, a diagnosis spread elsewhere, most commonly to the bones. It is a hormonally sensitive disease. The prostate cancer cells need testosterone, the main male hormone, and so this is something we can use to attack them. Early on, we use hormonal agents such as Lupron or Zoladex or similar drugs that basically work to shut off testosterone synthesis in a man. So the prostate cancer cells are deprived of their food or fuel and they die. Unfortunately, what we cause for the man with this is a male menopause, which is the equivalent of the female menopause. So irritability, muscle loss, mood lability, loss of libido. So unfortunately, hot flashes, it can be somewhat unpleasant for some men, although most of them are able to maintain productive lives through that. So that's the initial hormonal endocrine therapy, if you will. But eventually, no matter how good a response men achieve with what's called androgen deprivation, testosterone deprivation alone, a few of the prostate cancer cells survive and start to progress. And we usually see that as a rise in the PSA, prostate-specific antigen. And until 5-10 years ago, we used to think these cells were no longer dependent on testosterone, the main male hormone. What they've actually learned to do is synthesize their own testosterone. And so they are stimulating themselves. But this gives us some other weapons. There are two hormonal agents, both pills, that are commonly utilized. One is called enzalutamide, the other is abiraterone. They work by different principles. Enzalutamide impedes testosterone binding to its receptor and impedes that complex of the two getting into the nucleus, the control center of the cell, and affecting the expression of genes. Abiraterone, in contrast, basically impedes testosterone synthesis, but the net effect is they're depriving these prostate cancer cells of testosterone. So those are the two most commonly used endocrine agents.